It's an honor to be here today to be able to highlight the life and accomplishments of my friend and mentor, Dr. Mark Palumbo. Conflicts of interest not related to this talk. Mark Palumbo was born January 29th, 1962. He's the oldest of three children, has a younger brother and younger sister. He was raised in Providence but moved to Johnson as a young child. He attended the illustrious Bishop Hendricken High School and was an excellent student and excellent athlete. He played varsity football, varsity baseball. Here you see a picture for us that knew Mark Palumbo. He sticks right out as number 34. His excitement is obvious at winning the championship here. He had a hallmark smile. This is his high school graduation, and for all of us that knew Mark, his smile and his laugh were completely contagious. And you see here, he's just grinning ear to ear, so proud of his accomplishments. He was always an excellent student. He achieved a full ride scholarship to BU on a 6-year combined BA and MD program, graduating magna cum laude. Here on the right, you see Jesse Jupiter. For those of you who don't know, Jesse Jupiter is a world-famous upper extremity and hand surgeon at Harvard, extremely accomplished academic orthopedic surgeon. And Mark Palumbo did an intern year and then spent a year with Jesse Jupiter. We all knew that Mark always came to work early. He was one of the very first people at the hospital, and he always told me stories about how when he worked with Jesse Jupiter, he could never get into work earlier than Jesse. Jesse was always there working at his computer, editing a paper when Mark came in. And Jesse was one of the ones that really inspired Mark to pursue not only orthopedics, but academic orthopedics. After completing his internship and then a preliminary year of residency in Virginia, he transferred to Rhode Island to do his orthopedic residency at Rhode Island Hospital in Brown. He then went on to spine fellowship with Henry Bowman. This is Henry Bowman. He was a world-famous orthopedic spine surgeon, arguably the most famous orthopedic spine surgeon who trained a whole generation of thought leaders in orthopedic spine. He had people visit him from all over the world to see his techniques in cervical spine surgery. He really revolutionized the art of spinal decompression, for which Mark really took to the next level in his career, and he was a huge inspiration to Dr. Palumbo. Dr. Palumbo had a relentless work ethic. He was always studying and striving for excellence. And in fact, he achieved the 99th percentile on his orthopedic board examination. This is an unbelievable accomplishment, as orthopedic surgeons tend to be amongst the highest test scores in all of medicine. And for Mark to rise to the top, to the 99th percentile in orthopedic surgery, is truly unbelievable. And in fact, when he was recertified, he yet again was in the 92nd percentile, showing that he continued to study general orthopedics, not just spine, all the way through his career. His surgical career began at Brown in 1996 when he was recruited back by Mike Ehrlich. Michael Ehrlich founded the orthopedic department as we know it today, and really promoted his department with hardworking orthopedic surgeons who are absolutely dedicated to high quality patient care, who were teachers and researchers, and Mark Palumbo fit directly into that. He came and joined Phil Lucas to form the Brown Spine Division. Phil Lucas, when he started in the orthopedic department, everybody used to do spine at Rhode Island Hospital. All the orthopedic surgeons would chip in. Phil went up to Toronto to train with John Kostwick and really became the first orthopedic spine surgeon in Rhode Island, and held that title for a decade on his own until Dr. Palumbo was recruited back to start the division, for which they ran together for 20 years. For any of us who ever operated with Dr. Palumbo, you know he always had his x-rays up on the board, and he was disciplined beyond imagination. He did his surgeries the same way every time, and every time that surgery was performed to perfection. Every detail was important, and he never compromised. Everything from the patient positioning to every detail in the surgery to the wound closure, same way every time. And it was the way that Dr. Palumbo knew he would get an excellent result every time. He was also a highly organized, principled surgeon. He had the surgical plan posted in the room for all to see. The reason this is so amazing is that when he started doing this, this was before the time of briefings and timeouts and all of this that we do now. Mark had the plan up. For his complex cases, he would write out the plan for the anesthesiologist, for the neuromonitoring tech, for the sales reps, for the nurses, for the scrub tech. So everybody knew every step that was going to be completed, every supply that was needed. Truly was ahead of his time and is an excellent principle for us all. As the chief of spine surgery, he truly led by example. He achieved surgical mastery, and he did this based on his study of musicians and athletes. And what I mean by that, at our alumni meeting one year, he gave a great talk about athletes and musicians who achieve mastery in their chosen sport or instrument. He talked about the 10,000 hours that it takes, and he was extremely focused on dedicated practice. I'll give you one example of this, which was that Mark and I had a case scheduled, a T2 pedicle subtraction osteotomy, which is a case that we very rarely do. And he told me he wanted to do it in the lab on a cadaver. We went to the lab, we practiced over and over on this cadaver, and lo and behold, when we performed the surgery on our patient, it went perfect. And when, you know, after the case, we talk, we debrief, talk about what went well, you know, what we could do better. And truly, Mark was a master at dedicated practice. He was also a master documentarian. I highly encourage any residents going into spine and fellows to read his op notes. It's incredible. It's like reading out of a textbook. Every single step highlighted, every instrument, every finding. It took amazing discipline for him to do this. As some of us know, after a long day, you just want to get through your dictation. Not for Dr. Palumbo. Every single detail included, no matter what. It's really incredible to read his op notes. It truly was an experience operating with Mark Palumbo. His intensity was truly legendary. You see Jim Bolton in the background here, and you can imagine it, the intensity is palpable in this picture. His case may or may not have been going well, and certainly he was going to be hard on someone for something. His intensity, however, was not meaningless, and I got a good laugh with Phil Lucas and Vicky Go yesterday, which was the 1-year anniversary of Mark's death. We were at his grave and talking about the intensity of Rhode Island Hospital operating rooms on Mondays, where it was Mike Ehrlich in the white room, Mark Palumbo in room 4, and Rick Limbert in room 3, all with Sandy Madison running the helm. And I chuckled because they were so intense, all of these individuals, but it was only so that patient care was optimal. They wanted to make sure every case went perfect, and there was no excuse for anyone to ever not be doing their best. He was truly a master of balancing criticism and praise. So he was, you know, constantly hard on people, criticizing, but there was a point to it. It was meant to inspire excellence, quality, and to sometimes lighten the mood. If the case was going well, Mark's room could be a lot of fun to be in. He loved heavy metal and he loved perfect x-rays, and it wasn't just his love of symmetry, you know, that he wanted a perfect x-ray. There was two things. The first was he loved heavy metal because he knew that rod fracture was a problem. And he and Craig Everson came up with the idea of using 4 rods to decrease rod fracture rates. So he liked using extra metal that helped increase the longevity of the construct. For his perfect x-rays, he knew if he had a perfect x-ray that screw was in the right place no matter what. And he used more fluoroscopy to get there, but I will tell you, over his entire career, I do not know of one case that Dr. Palumbo had to take back for malpositioned instrumentation, which is an unbelievable feat in a 25-year career. He truly was a master surgeon. To get there, he was prepared and organized. This is from his office at the Kettle Point facility. This file cabinet is still there. His innumerable 20-page surgical guides in his files, and he went through and he typed out every single step to the operation, and it's really incredible to go and read through these. He was also an innovator. He learned from other specialties. This was a paper called The 12th Rib Incision as an Approach to the Kidney, and Mark went and he studied and he highlighted and underlined each step and tried to learn from it to optimize his spine exposures. Truly unbelievable. He was a master clinician. Several lessons that I'd like to remind the residents and fellows of that Mark used to, I'll say, beat into us trainees. First, always document and document thoroughly. I told you about Dr. Palumbo's documentation. Residents and fellows sometimes will write a quick note, maybe a kind of a cursory exam and say, we'll discuss with attending, but that was never good enough for Dr. Palumbo. He would encourage us and demand that we go back, document every finding, description of the rationale of what treatment would be offered, description of the rationale of what treatment was decided upon, risks, benefits, alternatives. He was absolutely incredible in terms of the documentation, and it will protect you. And so he encouraged us all to do so, especially in spine. He encouraged the residents and the fellows to undergrade the weakness, not because he ever wanted anyone to lie, because he wanted everyone to understand the subjective nature of the test and to protect yourself. The reason being, if one resident sees a patient, they think the patient has a 4 out of 5 strength, and then the next resident the next morning thinks that strength is 3 out of 5. You may interpret that as a patient going downhill or becoming worse neurologically. That may encourage one treatment where if in reality that patient is not actually weaker but the same, they maybe don't need the operation. The point is protect yourself, protect the patient, undergrade the weakness. If you think it may be a 4, may be a 3 out of 5 strength, put the 3 out of 5. He also encourages fellows, do the night case, get out of bed. Someone has a spinal emergency, don't roll over and go back to bed. Get out of bed, do the case. You will never regret it. You might regret going back to bed though, I promise you that. He also wanted our trainees to get the MRI. He would say, you're not here to save money. And it wasn't that he wanted to overutilize tests, but the point is if you think you need the MRI, don't let the ER or the medicine doctor say, we don't think we need it. You're the spine surgeon, get the MRI. Finally, he would say, I didn't break his back. And it wasn't that he wasn't sympathetic. It was that when young people get fractures and they need long fusions, some of the younger spine surgeons say, well, I really don't, this patient's going to be stiff and it's a big surgery. And his point was, listen, this patient has a bad injury. It's your job to fix it. We know that it may lead to stiffness, but you've got to fix it and fix it the right way, because in the end, it actually protects the patient from further complications and problems. With all his great teaching, he won the Teaching Excellence Award twice in the Brown Orthopedic Residency Program, both in 1999 and 2008. I assure you he would have won again if he was still with us. With all of his seriousness, he really could let loose and connect with his trainees, however, on a personal level. This was at the Brown alumni meeting. You see Shaunis Mende, myself, Phil Lucas, and Matt McDonald all there with Mark, and he treated his trainees like family and friends. Here he's sitting with Vicky Go, Mason DePass, Chris McCarthy, Stefan Ha, Kaylee, Dr. Lucas, myself, and our wives, and he's here with a huge group of people that he treats like family, who he wanted to be with, and he loved going to these dinners. It's a lot of fun to connect over a meal and some drinks with Dr. Palumbo. He was also a mentor to so many. He co-founded and then directed the Brown Spine Fellowship for 15 years. This here is Jess Adlin and Rich Talrico, and they truly were family to him. They were like children. He would check in on them and knew their families, and he loved to talk about them. He was so proud of their accomplishments. And it was just really great to see how he connected with his trainees. The Brown SUNY meeting was and is a great tradition. He founded this with Rich Talrico, and for 10 years, they had this great meeting where all the trainees from Brown would come back, talk about spine, go over their cases, go over their complications. Just a wonderful collaborative effort that certainly will continue, but was really founded by Mark. He was the best partner. There is no doubt in my mind that Mark is the best partner that I've ever had and probably will ever have. He never complained about staying late at night or coming on a weekend to help me. Mark, when I first started, he told me that the reason he felt that he was so good at spine surgery is because he had Phil Lucas behind him when he started. He was never scared to take on a case because he always knew that Phil could help bail him out if there was a problem. Then when Craig Everson and I talked when I first started, Craig told me the exact same story about how Phil and Mark were both there to help him if he ever ran into trouble. And I'll tell you now, now that I'm a good few years into practice, reason I have become the spine surgeon I am is because I always had Mark, and Craig, and Phil behind me to help me in any trouble I got in. And my only hope is that Dominic Kleinhens and Aaron Curris feel the same way, that they know that we are still there behind them to help them when there's ever trouble. We're always there. Complex spine surgery is not to be completed by junior spine surgeons or fellows without help. It is to be completed by surgeons with experience and to help their junior partners to really get the best outcomes. He was truly a roast master. I remember this so clearly. This was Chris McCarthy's graduation, and he was so good at being witty and funny in public speaking and being able to really roast someone at the same time complimenting and appreciating the work they had done. And this was maybe one of the best and funniest speeches I've ever heard. Mark gave great advice. John Schiller and I were talking yesterday about the fact that he was really a no BS kind of guy. He was always honest, would always give you his opinion, but was a great listener. And this is Mason to pass at graduation. You know, probably telling Mark some story, asking advice, and you knew Mark was going to give great advice at all moments. If you were ever having trouble, he was my first phone call. He really loved the outdoors. Mark loved to hike, mountain bike, and fish, and just was passionate about it. And with that, he was a great team builder. So he I'll say, dragged a few of us up Mount Washington more than one time. You see here, he's got his son and daughter. He's got multiple industry people. He's got Roger Robin, the OR nurse, and myself climbing Mount Washington. And he built the team, said we're hiking this mountain, and we did it. And we did it multiple times. And he got a bigger and bigger group each time. And I see Rick Tarrick and his wife here. And it really was an absolute blast. Weber Schill, who was great friends with Mark, is here in this picture, and they used to bike and hike together and talk, you know, university orthopedic strategy. These events were just absolute blast. He was a master at attracting talent. You know, these two girls, Kaylee and Krista, our PAs, are just spectacularly talented, and he knew it, he saw it, he hired them, and you know, he worked with them for years, but I hope to work with them for decades, and I'm just so lucky that he found them. I want to change tunes a little bit and talk about research. Mark was a great researcher. However, it was very painful doing research with Dr. Palumbo because he has what I call painful perfection. It had to be perfect. He didn't care if he had to edit the paper 25 times. And because of that, the pace was slow. But at the end, the product was always perfectly polished. And I remember people like Nikhil Thakur, Mason DePass, Sean Esmende coming to me and saying, it's so painful doing research with him. But trust me, it was worth it in the end. And I'll tell a very quick story. I recently testified in a trial where one of his papers was a key piece of evidence. And, you know, the lawyer went through it line by line, and that thing was rock solid. There's not one word out of place. It was clear what he intended. There was no missteps, and it was, let's just say it was very easy on the stand to defend the stances in this paper. This is very interesting to me. This is the beginning of his research career, 1996, and Mark's talking and researching protective football equipment with two of his friends and mentors, Mike Holstein and Paul Fideli. And it's a perfect intersection of his youth, which was a passion for being an athlete and sports fan, and his passion for spine surgery. And so this is a great start to his career where he's researching something he's really passionate about, looking at the alignment of the cervical spine in the helmet and out of the helmet. As he headed into his career, this is a paper in JBJS where he really had world famous, you know, star co-authors. He's got Dan Rue and Alan Hillebrand, two world-class spine surgeons, on this paper with Henry Bowman with him, where they're examining basilar invagination in the rheumatoid patient. And cervical spine surgery remained a passion of Dr. Palumbo's throughout his career. He also had several early impactful contributions to spine surgery. This was a paper on thoracic stenosis, one of the very first papers ever examining this problem, written with a very good friend and mentor of mine, Bob Hart. It's always fun to look back at his Henry Bowman years and all the connections he made with other people that I know and still collaborate with to this day. He was also always forward thinking. This is 2005. He's looking at lumbar disc herniations and some of the issues with accuracy of evaluation of information on the internet. Still a problem today, and this paper has been repeated many, many times. He also wrote a landmark paper on the dangers of halo placement in the elderly. This paper arguably has had more clinical impact than any paper that, certainly that I've ever written, and any other paper that Mark wrote. We later looked at the data and saw that there was a precipitous drop in halo utilization in elderly patients after this paper is written nationwide, largely due to this. And I would tell you that this paper has certainly saved lives. He was always interested in complications, and his goal is to optimize outcomes and decrease complications. So these papers looking at airway issues after cervical spine surgery are the perfect way for him to mix his passion for cervical spine and complication minimization. He also encouraged us to never falter. You know, that I know of, he never did a wrong side spine surgery. It's a bit scary, but I will say that wrong side spine surgery is very easy to do and is very common, actually, unfortunately, in spine. So he wrote this paper in the Yellow Journal that is an absolutely phenomenal step-by-step guide to never committing wrong side spine surgery. I highly encourage any residents, fellows, and any young spine surgeon to read it. He was truly a surgical innovator, as I talked about earlier with the 4-rod constructs. He, myself, Craig Everson, wrote this paper outlining the technique, which has now become the standard of care in spinal osteotomies and complex spine. He loved researching high-risk pathology. He loved talking about it and teaching about it too. And this paper on spinal epidural abscesses, it's the perfect thing where it fit into his practice so well because he loved what he called tertiary care spine surgery, complex problems. And spinal epidural abscess is generally a great problem because if you intervene appropriately, you can save these people from neurological catastrophe. And if you don't, you may have a problem. And so he'd like to try to teach people about how to identify the problem and manage it. He really did have a medical legal focus. He loved malpractice litigation work. And I want to talk about why briefly, because I didn't understand that when I first met him. So why should you? Well, first, he stated it was a true opportunity to police ourselves. Amazingly, and it's a bit scary, but the medical boards don't always do a great job of policing surgeons and physicians. What I mean by that was when there's negligence, whether it's one time or a series of negligence cases, sometimes the medical legal system is the only way to actually, I'll say, discipline the doctor and get them out of practice, or at least get a settlement for the patient. And he was not afraid of this. A lot of physicians, surgeons are afraid to talk about it. He wasn't. It's also a way to diversify your career financially. What that means is, you know, if you become disabled at some point, you can't operate anymore, or if the practice of medicine changes so much that it's not financially beneficial for you, medical legal work is a great way to earn a living. It's intellectually fun and challenging, which now after venturing into this work, I will tell you is true. And the last thing is, I just want to mention that writing papers on complications is your avenue into expert witness testimony. So if you want to do expert witness testimony, write some papers on complications, because then the lawyers will come to you asking for your help. He was truly a revolutionary thinker. This talk is from 2009, and it's amazing to listen to him go through his description of why he loves spine surgery, where spine surgery is, where it's going, and what University Orthopedics' vision is. And so I'll let you listen here.
Hi, my name is Mark Palumbo. I'm an orthopedic spine surgeon working with University Orthopedics in Providence, Rhode Island. My specific subspecialty area within orthopedic surgery is spine surgery, and in particular, my practice is focused on the treatment of spinal diseases and disorders in the adult patient. To me, spine surgery is both the most challenging and the most rewarding subspecialty area within orthopedics. Our patients, or our spine patients, are many times afflicted with life-altering and sometimes life-threatening disorders, and the ability to be part of the process to restore them to well-being is, highly gratifying from a professional standpoint. Certainly the spine field is constantly moving forward. There are all types of new technologies. As a group, we're still working through the correct applications of many of the new technologies and are still in the process of verifying the advantages of new technologies. But having said that, there are a number of ways we're treating the spinal column surgically that are much more advanced in terms of technique than things were 15, 20 years ago. Surgeries and operations we did in the past that were done through large incisions and required protracted recovery times in the hospital and afterwards are being modified so that we have less invasiveness to the procedures, less trauma to the individual patient from a surgical standpoint. And that's allowed us to manage many diseases in a more efficient fashion for the patient. They can get through their hospital stay quicker with less discomfort and with a more rapid restoration of functional. The reality is that the vast majority of individuals with spine problems can be treated without surgery, and that is our focus here. I mean, we're a very conservative group of spine surgeons that try in every way possible to get people back to health and life and function without surgical intervention, and the physical therapists here at University Orthopedics are a critical part of that process. That is one of the true advantages of working here with University Orthopedics. It's that integration of care both across the group of physicians and then in collaboration with the physical therapists, the occupational therapists. I mean, they're here on site, they're high-level, accomplished physical therapists, and they communicate with us directly on a regular basis. So if someone's not making the progress they should be in physical therapy, then I know about it immediately. We can adjust on the fly. I think there are a lot of advantages for an individual seeking medical care in terms of coming to University Orthopedics. My personal opinion is that the greatest advantage is my access for the welfare of my patients to a group of highly accomplished clinicians and surgeons. I think we really provide the highest level orthopedic care in the greater New England area. Many of our physicians and surgeons are scholars, they're teachers, they're researchers, they're on the cutting edge of their fields, along with being excellent clinicians. The affiliation with Brown University, and I'll loop into that Rhode Island Hospital as well, because Rhode Island Hospital is the primary teaching facility, if you will, for the Brown University medical system, to me is a huge advantage in my practice. We have world-renowned experts, regional physician experts, if you will, that can provide the highest level of care. And to me, they're at my fingertips. I don't think I could operate my practice efficiently and with the highest level of safety anywhere else except this institution. Another example of more of a newer technology treatment that we can offer in spine surgery is exemplified by a very nice young lady who I recently took care of. We'll refer to her as Roxanne. That's her real first name. She happens to be a very personable, active, physically active woman who owns and operates a farm where she raises horses and trains horses. And she developed a problem known as a disc herniation in her cervical spine or her neck, which produced pressure on one of the nerves going to her arm, and that resulted in severe pain in the extremity along with weakness and dysfunction. And these were things that were obviously life-altering, at least with respect to her work situation. So she elected to undergo an operative treatment which consisted of removing the herniated disc and removing the pressure from the nerve structures in her neck, her spinal cord, and her nerve roots. And that was done through a small incision in the front side of the neck. That part of the operation was done to relieve the nerve problem she had, the severe pain in the arm, the weakness in her arm. Following that component of the procedure, we need to reconstruct the spine or rebuild the area where we perform the surgery. And that, in her case, given her youth and her high activity level, we utilized a newer technology called cervical disc replacement or cervical disc arthroplasty. It's what's called a motion sparing reconstructive technique, very similar to what most people understand in the extremity joints, a hip replacement, a knee replacement, where instead of fusing the joint, making it stiff, we reconstruct the joint but maintain its mobility, maintain its function. And it really ended up with an excellent outcome for her. She has maintained all her range of motion. Her arm pain and weakness have completely resolved, and in some ways, against my advice, she returned to work and physical labor, if you will, very quickly after this procedure and has continued to do so over the past year. And I recently spoke with her, in fact, this week, and she was going to join us today, but was on her way to a horse show in Springfield, Massachusetts. And spine surgery can be challenging at times, and we don't have a perfect solution for every problem, but certainly for an individual like Roxanne, when you're able to eliminate someone's pain and really restore them back to what they consider their normal life, it is absolutely the greatest draw to orthopedics in general and to spine surgery in particular. And it's what keeps you coming back as a surgeon. We have difficult days, we have good days like any profession, it's really the primary draw that kind of keeps you rolling forward and gets you through tougher times, but really keeps you coming back to try to help people.
It's really incredible to listen to that and understand that his vision of University Orthopedics has come true and grown so much over the last 10 years. And so now I want to show you a video 10 years later of really his vision coming to fruition in 2019.
As part of our University Orthopedics initiative to improve the patient experience, we've tried to make access better for our patients, and part of that is developing two major sites on each side of Narragansett Bay. The East Bay will be our Kettle Point facility in East Providence, and on the West Bay we have our facility on South County Trail. Both of those sites provide same level parking, very direct access to our facility for patients who may have impaired ambulation capabilities or who require assistance or simply can't travel long distances. So the idea is to make it as convenient as possible on each side of the bay to provide the highest quality care in close proximity to where patients live.
It's amazing, again, to hear him talk about patient care, because in the end, developing these sites, including Kettle Point, was all about patient care. And what some of you may or may not know is that Dr. Palumbo was absolutely instrumental in achieving the Kettle Point facility. And what I mean by that is he helped identify the site. He worked with Mike and Teglia on development, fundraising, and alongside of Dr. Ackelman and Weber Schill here, really making this facility happen. So I encourage you, anyone who's been here or hasn't been here, to come visit. And I know every time I walk into this site, I thank Dr. Palumbo for the work he did to create it. And I'm so thankful that he was able to work here and to take care of patients here and to operate here and see his dream come true before his untimely death. He was truly an opportunist, and he was very forward-thinking. I saw in my files the other day this, and it's titled "The Intersection Between Telemedicine and the Corporate Practice of Medicine," and he wrote "Save This" and handed it to me. And you know, he passed away before COVID ever was a problem. And think of what telemedicine has done during the COVID crisis. So he saw this, and he saw this need, and he knew there was going to be a need for this in the future. It's just really, it's unbelievable. His family was so important to him. He was a very dedicated husband to his wife, Anne. He was a loving father to his children, Kristen, Nicole, and Mark. He so often had lunch with his mother during his office days, and he really just adored her, and they were so close. And he was great friends with his brother Ralph. You know, they would be on the phone talking often about family and business. And despite his busy surgical career, family was always a priority, and he talked to me about that often. Kristen sent me this picture, and she just said, "Look how happy he looks." And I agree. I mean, truly, when he was his happiest was when he was with his family. It just has a wonderfully supportive, beautiful family. Sickness did not change Mark. He persisted with all the focus, passion, and stability as he went on. And I want to thank Scott Malozzi, Dominic Kleinhens, Ed Smith, and PJ Wagner. They were our fellows during the time when he was sick, and they helped him to be able to continue practicing. Now, Mark was still a spectacular surgeon until he stopped, and meaning that he had mental focus, physical ability, but he would get a bit tired during these long spine cases, and so he would let the fellows do certain components, and he'd take a break, and we call it his throne he would be in, and he was just, it was so great that he was able to keep working with us even when he had issues with his health. Tragically passed away 1 year ago yesterday, September 15th, 2019. His grave is in St. Anne's Cemetery in Cranston. For anyone who hasn't been, if you ever want to visit him, it can be a very meaningful experience. I've visited him many times. And if you ever feel that you need his presence, he's always there for you. This video Pete Lucas put together and is an absolutely beautiful representation of many people who loved him. So I now want to play it for you.
The first thing I would say about Mark Palumbo is we miss him every day because he was such a presence in the middle of this organization. One of the founding members of what we are as an organization. He was everything that you'd want in a human being and an orthopedic surgeon. So he was a great technical surgeon and physician. Patients still ask me about him. He, as a spine surgeon, that's very complicated surgery, and he was really a master technician. So he loved taking care of patients. So I think of him like that. I think of him as a master educator. The bar that Mark set in educating residents and fellows at Rhode Island Hospital and Brown University and University of Orthopedics, there was no higher bar.
I even remember the first case we did together. It was a tough injury to the pelvis, and he came in, and it was amazing. He was a junior resident, and he knew the anatomy. He was prepared. He really, I was really impressed. And and then as he went along, and finally decided to go into spine, I was really so happy that was his decision. I think back almost every day. I think about him. Something comes up, even coming into this building. He was so involved in the construction of Kettle Point. I see a lot of his patients now, and they really, they talk about what a great physician he was. He spent a lot of time with them. They felt they had a good understanding of what he was going to recommend in terms of surgery. So they really they miss him also. I think the other thing that Mark, he was a great teacher. We have a conference every Tuesday morning with the residents, and he really was so organized. He was terrific in terms of presenting a case and having them answer questions he would raise, and I miss that because and I think it's we're trying to continue that, but it's tough. It's hard to replace.
Well, I had the great fortune of getting to know Mark all throughout my career. When I interviewed here for residency, Mark was a chief resident, and I remember sitting with him and being so impressed with him. And I just figured that all residents are going to turn out just like him if they come here, and I should come here. And when I got here, I realized he was a special person. The amazing thing about Mark is Mark could walk into any room and immediately be at ease, and immediately people would be drawn to him, and that's the kind of person that he was. And you would see him, interacting with, the local guy down the street, the president of the university. It didn't matter who you were. Mark treated everyone in the same way. The other thing I always remember about Mark when I think about him, and there are many things obviously to remember about Mark, is, I had a very rough patch in my practice where I was doing complicated surgery. I was on call. I was crazy busy. I was running around. I had all these things on my plate. And Mark had arranged a dinner for some of the spine folks. And I'm telling him, Mark, I'm really busy. I'm not sure if I'm going to be able to make it. And I remember Mark called my wife and said, listen, I'm worried about him. He's working too hard. He's got to slow down. You make sure he comes to this. And what I didn't know, what I learned, after Mark passed away, so my wife said he called her not infrequently. And who does that? Nobody does that. And he said, I know we all work hard. Mark was at that point in his career when he was my age, that he was working too hard and didn't appreciate things in life. And that was just his way of saying, listen, I'm not going to tell you what to do, but I'm checking on you. And you always knew that he was checking on you, and it's pretty amazing. So You know, it's hard to describe Mark in one word, but you know, he was an amazing friend. He was an amazing surgeon. He was an amazing teacher, and just an amazing person.
And he was technically gifted. He was a true physician where he really cared for his patients carefully and thoughtfully. And he was a great mentor to a whole generation of spine surgeons in Rhode Island and across the country. He did excellent research. He was a superb physician, cared for his patients. He cared about the community, and he was a great mentor to me and many other surgeons who he trained over the years.
You know, Mark always wanted to build university orthopedics into something more. It was basically because of his drive to improve patient care and the patient experience. He really felt that even though Rhode Island's a small state, there's no reason that it could not have a regionally excellent orthopedic center to take care of all the musculoskeletal problems of the population.
You know, we were good friends outside of work, and you know, and that's where, you know, I think I had the opportunity to learn as much from him as I did at work and as a spine surgeon. He was a big part of the Rhode Island community. You know, obviously he was known as a great surgeon, but he was also, you know, very involved with extracurricular activities and had a wide circle of friends, and you know, he was so he had a big influence on people in multiple different ways.
You know, one thing I thought was he really developed a relationship with my dad, actually, when I was in training. And you know, my dad said, you know, he's the kind of person that, you know, when your son or your child goes into the world, you hope that in their career they find someone who brings them along like he did for me.
I think he was a great teacher. His legacy lives on through his fellows that he taught, through the residents, and so I think we're not going to forget him soon, that's for sure.
Dr. Palumbo left his mark on all of us. He taught us to demand perfection in every situation. He taught us you can be tough and strict while still being compassionate, thoughtful, and kind. He taught us to relentlessly dedicate ourselves to our families and our patients. And there truly will never be another Mark Palumbo. We have several honors that we are providing to him after his death. First is this lecture. So this was the first annual Mark Palumbo Lecture in Spine Surgery. Each year we will have preeminent spine surgeons come and lecture us on spinal research and techniques to help further the mission that Dr. Palumbo started. As you know, there was going to be the Mark Palumbo 5K race to benefit the Tomorrow Fund. We unfortunately canceled this year due to COVID, but I have full plans to perform the race in 2021. Memorial plaques will be placed at Rhode Island Hospital and the Kettle Point facility. And finally, we are fundraising for the Mark Palumbo Professor in Spine Surgery. And it's a way for us to honor his academic vision for perpetuity, and so that someone will hold the Mark Palumbo Professorship who does spine research forever. I want to thank the Palumbo family. They have suffered more than any of us. They gave up so much time when he was away, and not only when he was working, but then when he was sick. And I just want to thank them so much for all their support. Thank you.